Hi there, Dr. Grant Blashki from familydoctor.expert. Today we're talking about starting the oral contraception pill, and I have 10 questions for you to consider if you're going to start the pill. Question 1, why are you starting it? Is it for contraception? Is it because you're getting painful bleeding or heavy periods? Or is it to try and fix your skin, acne issues? Is it to help with mood, premenstrual syndrome? Whatever your reason, you need to talk to this with your doctor because it may affect which pill they choose for you. And always remember that the oral contraceptive pill doesn't provide you with protection against sexually transmitted diseases. You need to use condoms to get that protection. Question 2. Is the pill the best contraception for you? Have a chat with your doctor. There's lots of alternatives. There's what we call the LARCs, the long-acting reversible contraceptions. And there's things that can be implanted and injected and IUDs and lots of other possibilities. So chat with your doctor if the pill is the best for you. Now, if you do decide to go on the pill, there's a whole range of different pills. There's the mini pill, which we're not going to talk about much today. That's the subject of another Family Doctor Expert video. But if, as most girls do, you go on the combined pill, there's still quite a few questions to think about. Are you going to go on what we call the MONODOSE pill, where you get the same strength of tablet every day, or are you going to go on a phasic pill or a cyclical pill? Another question to discuss with your doctor, are you going on a weak or a strong dose? And the other thing to think about is which sort of hormone. Are you going to go on the standard pill, or are you going to go on some of the new synthetic pills, which have a slightly different risk profile, seem to be quite good at helping reduce acne and some of the mood problems, but tend to cost more. So you have to chat with your doctor about that. And the other thing to think about is some of the pills come with the little placebo tablets, the sugar tablets. And do you want to have a packet of 21, which has no sugar tablets, or a packet with 28, which includes the sugar tablets? So lots to think about. Now, question 3, contraindications. Who shouldn't have the pill, or should at least think very carefully before they take it? People with migraines, especially visual migraines, visual auras, anyone who's got a history of clots in the legs, what we call deep venous thrombosis, or any propensity in your family or in your history to have clots, things like heart attacks and strokes, got to talk about this with your doctor. If you're over 35 and you smoke, the combined oral contraceptive pill, probably a bit risky for you. If you're overweight or you've got type 2 diabetes, got to talk to your doctor. You're taking other medications, make sure you mention that to your doctor. They can interact. So there's lots of other contraindications which your doctor will talk to you about. Question 5, what are the side effects? Common side effects of the pill. Some women are lucky and they hardly get any effects, but common side effects are nausea, vomiting, breast tenderness. Some women get breakthrough bleeding, especially the first few months. That means bleeding in between your periods, which is pretty annoying. Some people get high blood pressure. Your doctor will want to check that. And there is some concern about cancer risk. These are all tiny changes in the rates of cancer, but there is some debate as to whether the pill could increase breast cancer and maybe cervical cancer very slightly. But on the other hand, it seems to lower risk on uterine and ovarian cancer and even bowel cancer. So your doctor will weigh these up. They're tiny percentages, but they're worth considering, and your doctor will think about that and talk about it with you. Next question, 6, could you be pregnant? Don't really want to start the pill if you're already pregnant. Has potential problems. So tell your doctor when you had your last period, and if you think there's any risk that you actually are pregnant, that's worth checking for before starting the pill. How do you start it? As usual, check the patient information sheet. Look at the instructions, but the main principles are to take it every day. Take it at the same time every day. Consider getting a mobile phone app which will remind you to take it every day. Start on the first day of your period, and usually, if you have a look at the example packet here, if you get your period on, say, a Thursday, you start the pill in the coloured section on the Thursday. Similarly, if your period started on a Tuesday, just start in the coloured section on the Tuesday and take one every day. So what if you miss one? Easy to do. First of all, if you take the pill within 24 hours of realising that you've missed your usual pill, then you're covered. There's no problem. But a missed pill, which we define as more than 24 hours late, so that means 48 hours since you took the last pill. This is a missed pill. So what do you do about that? Don't panic. You take the pill when you realise, even if that means taking 2 pills together the next day, that's okay. And use alternative contraception, particularly, for example, condoms for a week to make sure you're covered. Now, the next thing you want to do is you go, I've missed a pill, I'm going to have a look at my packet. Was it in the first week? This is one of the more risky times, actually, to have missed a pill. So the first week after the sugar tablets is a time where you might be at risk, and you might talk to your doctor about getting some emergency contraception, which is the subject of another Family Doctor Expert video, but it might be worth considering. If it's in the second week that you've missed the pill, you're probably fine. If it's in the third week when you've missed your pill, the best thing to do would be to miss the sugar tablets at the end of that cycle, to go straight on to the next round of hormone pills. So as usual, check the instructions, but that's the general approach to a missed pill. Now, how do I skip a period? This is what many women come and ask us at the clinic. So it's easier to do if you're on the monophasic pill. So remember, we talked about some of the pills come with varying doses and some of them are on one dose. Much easier if you've got one dose. The trick is not to take the sugar pills. So you take the hormone pills, and when you get to the sugar ones, just miss them and start the hormone pills in the next packet. So, final question, question 10. Will taking the long-term oral contraceptive affect your fertility? The evidence suggests no. There appears to be no long-term effects on pregnancy rates, so you're safe from that point of view. So lots of information. As usual, don't act just on the information in this video. Check the patient information, talk with your doctor, and I wish you well from familydoctor.expert.